I'm an IS professional, which means I work in the information services area, helping maintain the computer systems that make a hospital system work. I really wanted to, leverage that information, that knowledge in a way that I could help, improve patient outcomes.
I own and operate a rehab practice with multiple locations. Rather than treating patients clinically, I found that I was managing people, and I needed the skills to be an administrator in healthcare, not just a clinician that was in a managerial role.
I'm a medical doctor, and during my medical training, I realized that the healthcare system is broken, not just in my country, but elsewhere. So what I wanted to do, to be honest, I wanted to change the world. I decided not to run for a medical residency and instead going for management in healthcare.
I was looking for a program that covered a lot of aspects of healthcare leadership: advocacy, policy reform, project management. That's the reason I chose UCSD.
I think the biggest part of the program is that you get to meet people and you get to learn how healthcare systems work in other parts of the world.
LHCO has enabled me to quickly become effective in organizations that I'm in. I find that I'm much more marketable as a professional because of the skills that I have, and that I can point to many of the projects that I was successful in because of the LHCO program.
I could take everything that I was learning and literally apply it at work. Whether it was working styles assessments, project management, it was beyond just learning the curriculum. I actually got to tackle projects and work with people in real time. I was able to take the skills that I learned in the LHCO program and double and then triple my business, which was not what I was expecting to do. It really taught me how to manage the scope of a practice in a different way and learn how to manage healthcare outcomes and manage people in a more effective way.
I was able to find a job immediately during the program, and afterwards I decided I wanted to move to another organization, and found that I could join those companies very quickly.
By having all these tools and having the passion and the opportunity to teach others, that's the biggest impact, because at the end this is not just for ourselves as healthcare provider, but this will be for the future generations and for our population.
I'm sure if you're like me, you moved up the ranks in healthcare, but you don't know enough about leadership and you may be second guessing yourself. All of those questions can be answered through this program. There will be so many opportunities for you to make a difference and come out of this with the skills that you need in order to do the things that matter to you and to the populations that you want to serve.